So the first technique we're going to do is using two hands to move a cup, just to get our feet wet. And so we're going to actually cup straight down the spinal trough, directly over the spine. On most people, to do that, you need the smallest cup that we've got. Unless you're dealing with a linebacker, that's probably going to be the only size that works. Even still, the lumbar lordosis with the way the longissimus bulges up and it creates a little more of a trough may or may not stick. Honestly, I have better luck with the silicone doing this because it can deform a little bit to that shape. So I'm going to stick the cup on near T2. I'm going to take two hands and I'm going to lay these straight down on her and grab my cup with my thumbs and index fingers. And I'm just going to keep that contact with both hands as well as the cup. And slide the cup all the way down and then all the way back. If you have the suction light or medium, you probably don't have to worry about anything special other than moving the cup. If it's on the upper end of kind of acceptable, that medium closer to heavy, you may need to pin the skin so it doesn't try to come with you when you're moving the cup. So I'd hold it on this side on the way down, and I would need to hold the skin on this side on the way up, just like that. Also, if you're having trouble getting the cup to move, tipping the cup so that the leading edge in the direction of travel is just slightly elevated sometimes will make it a little smoother, easier to move. Like that. So then pop it off here. Coming back, I would want to tip this side of the cup here. Gently slightly up. Okay.
So what would be the benefit of going right into the spine? What would you use it for?
Mostly I use it for spinal pain and issues. You know, cupping, it helps with pain, even if it's not structurally doing anything that's going to change it. So if somebody has disc issues, somebody has scoliosis, ankylosing spondylitis, this would be appropriate.
I guess with scoliosis, you just follow the spine.
Yeah, it won't be a straight line. You'll track
Just
down.
follow.
You'll actually find on even people with relatively straight spines that the cup will sort of want to shift and track however. And in general, most people look at it as it keeps trying to pull towards the sides where the muscles are the tightest. I don't know if that's true. It kind of makes sense to be the opposite, that it would kind of drift away from the bulged up spasm in the muscle, but 6 of one, half dozen of the other. So that's straight down the spinal trough. And I'm going to put a little more lotion on her. I know. You can't have too much lotion.
Oh wow, that heats up quickly. Good.
That first one was a little chilly.
Right.
The second technique we're going to do is one-handed moving cupping. So we're going to put a cup on the erector spinae. Is that okay? On either side. Make sure they will twist. And you can do this by holding the top of the cup or putting the cup in that tiger's mouth between the thumb and the index finger there, going down. On the way back up, obviously, I can't really hold on to the cup very well there, so I'll have to move. I generally just leave my hands on the top. These can be done together, both moving the same direction, or they can be done alternating, where one is coming up and one is coming down. Get a little of that skin pulling myofascial release kind of cross fiber. Does that feel okay?
Yeah.
There is no appropriate speed for cupping. You can move as fast as is comfortable for you and your patient. Slow to medium tends to be more comfortable than whipping the cup around really, really fast, but you know, your mileage may vary. I stopped pretty quickly because there is already some Sha starting to come up and I want her partner to have a chance to do some cupping on her spine and erector spinae. So, simple and easy, both can go together or they can alternate. You'll get the feel of how hard you have to hold on to the cup without squeezing it so much that you pop it off or deform it too much. Grab your partner, give it a go. Thank you for being the demo, Wendy.